Hello everybody, I'm Dr. Amal Kamil, endocrinologist. In the coming few minutes, I'm going to talk to you about an important and daily emerging health problem. This is about the thyroid cancer. To start with, thyroid gland is a butterfly gland, a shaped gland located at the base of your neck. Normally, it will not be seen, but if it is enlarged or if it contains any abnormal growth, you can see it or feel it moving up and down while you are swallowing. The normal role of thyroid gland is to produce thyroid hormones that regulate our weight, heart rate, blood pressure, body temperature, and it has some other important functions. Regarding thyroid cancer happens when an abnormal and rapid reproduction of thyroid cells occur, which accumulate to form a lump or a tumor. And sometimes they become aggressive and invade the nearby tissue or go with the bloodstream to other tissues. The exact cause of these cells to become aggressive or activated is not known, but it is thought to happen due to some genetic or familial or some environmental factors. Some thyroid cancers grow very slowly and might not cause any symptoms at first, but as the tumor grows, it may cause swelling or a lump or a nodule that is felt or seen on the front of the neck. Sometimes patient will not feel this nodule, but he will come with pain of the neck and throat, and sometimes just with change of voice. If the tumor is big enough, it may cause difficulty in swallowing. Some patients may not notice any nodule in the thyroid, but they may notice enlarged lymph nodes around the neck with or without this nodule. Thyroid cancer is classified into types based on the kind of the original cells. Determining this type of cancer is very important in defining the best treatment and future follow-up. Types of thyroid cancers, according to cell type, include papillary and follicular, which are the most common diagnosed and defined cancers. But other types like anaplastic, medullary, and some other rare cases like lymphomas can also occur. Although thyroid cancer can affect any person like any other cancer, but some factors make some people having a higher chance of developing this cancer than others. This include being a female. As we know, thyroid diseases are more, all thyroid diseases are more in females, and this includes thyroid cancer. The other thing is previous or recent exposure to high level of radiation, especially if it is to the head and neck and chest. And if this radiation occurred during childhood, this makes the person is at higher risk of developing cancer. Also, if a patient have a family history of thyroid tumors or thyroid cancers or any other tumors, he may be at higher risk of developing thyroid cancer. Also, it's found that some inherited genetic syndromes make people or put people at a higher risk of developing cancers. So how can we prevent these people who are at high risk from developing the cancers? They found that people with an inherited genes of medullary thyroid cancer specifically may consider early removal of the thyroid gland as preventive. This is called prophylactic thyroidectomy. And also, people at a high risk of exposure to radiation or lives near nuclear power plants should have an expert counseling safety precautions and should be provided by medications that might block the effect of radiation. Anyhow, if you experience any of the above complaints or you find that you have a high risk factor, you should go and discuss your condition with your doctor. Your doctor will take a full history regarding your present complaints, past medical history, and previous surgical operations, and definitely will ask you about having any chronic disease or taking any continuous medications, and if there is any past or recent history of exposure to radiation, or if you have any family history of thyroid cancer or other cancers, and then most probably he will perform full general examination followed by thyroid or neck examination. He will examine your neck, look for any nodules or any change in your thyroid texture or shape, Then he may request some important testing such as the basal blood test to know your general condition, if you have anemia or any other complaints, any other condition. And he will request thyroid hormone test to determine if your thyroid gland is functioning normally or not. And he will request ultrasound imaging of the neck and thyroid, usually done by the doctor himself or by an expert person to get a better idea about the thyroid lump and thyroid gland condition. If they find that the lump looks like a cancerous one, or there is some abnormal cells or abnormality in it, then doctor may need to take a sample or a small tissue of the suspicious thyroid tissue using a thin needle, usually guided by the ultrasound. This is called fine needle aspiration. Then this sample would be sent to a special laboratory, pathology or histology, looking for cancerous cells and determine its type. Other imaging like CT, chest X-rays, MRI, and other imaging may be requested to find out whether the cancer has spread beyond the thyroid gland or not. Of course, genetic testing and family counseling will also be requested and done. This drawing shows how to take tissue sample using the fine needle aspiration. This is an easy procedure and usually will be done at the clinic. If doctor or the results came back, if doctor was suspecting and the result came back that the patient has thyroid cancer, then he will discuss with you or the patient the treatment options. Treatment modality for thyroid cancer depends on the type and stage of the cancer and the patient overall health condition and definitely his preference. The good news is that most of thyroid cancers can be cured with treatment. Most people with thyroid cancer might need to undergo surgery to remove the lump or all of the thyroid or part of the thyroid gland, and sometimes if needed the nearby lymph nodes also will be removed. Again, sometimes a special form of radiated iodine called radioactive iodine may be given after surgery to destroy any remaining cancerous cells. It is provided in a form of a capsule or liquid that patient will swallow. Very few cases with specific types of thyroid cancer might need an additional cancer treating medication called chemotherapy. After surgery, most of the patients and other treatments, most of the patients need to take thyroid hormone in form of tablets called levothyroxine for life to replace the missing hormone, and sometimes they may need to be given a higher doses of this thyroxine to suppress or to prevent recurrence of the thyroid cancer. During all this period of investigations and management, the patient and family will have a good support or continuous support by a specialized team of doctors, nurses, and other specialty trained professionals aiming to support patient and their family in taking their treatments and treating any symptoms or relieve pain and improve their quality of life, and they will provide an extra layer of support that complement the ongoing medical care. When you decide to go to your doctor or to see your doctor, write down any symptoms you are experiencing, make a list of all medications, vitamins, supplements you are taking, and take a family member or a friend with you. Write down the most important questions you want to ask your doctor regarding your thyroid cancer, type, stage, treatment options, effect on your daily activity and on other health problems. And again, if you have any question or doubts you need to discuss with me, you can contact me on the given contact information below. Thank you.